हाँ हो गया, एडमिट हो गया। ये मैं। अच्छा, आपकी तरफ से अलाउ करो शेयर करने के लिए, शेयर करी ना स्क्रीन मैंने। मैं तो ऐसा रखा। ओके।
A very good afternoon and warm greetings to one and all present here. On behalf of Samarpan Institute of Nursing and Paramedical Sciences, I extend a heartfelt welcome to all the dignitaries, speakers, sir, respected faculty members, students, and guests who have joined us from across various institutions on the national webinar series on redefining nursing practice, focus on adult health and surgical care. So, for day 4 of our national webinar series, we have with us Professor Deepak Kumar, sir, and I am much honored to introduce the speaker for today. Sir is currently serving as professor at Panadhai Ma Subharti Nursing College, Swami Vivekanand Subharti University, Meerut. Sir holds a master's in medical surgical nursing from Subharti University, Meerut, and is pursuing a PhD in surgical nursing at SVSU. His academic qualifications include post-basic BSc Nursing, Jivaji University Gwalior, and GNM from UPSMF Lucknow. So has gained over 15 years of cumulative experience in clinical, teaching, and administrative roles. So served as associate professor at Government Medical College, Prayagraj, and assistant professor at Subharti Nursing College for nearly 9 years. So, its key academic responsibilities have included NAC coordination, external examination, center in charge, admission supervision, and SNA activities. His research focuses on pressure ulcer prevention, stroke care, and tracheostomy nursing with numerous publications in indexed national and international journals. Sir is recognized as a certified simulation based education trainer for SGT University and has conducted hands on workshops on mental health, ventilator care, and crash cart management. Sir has authored a book titled Child Health Nursing and contributed as a book reviewer for leading nursing publications. Sir also holds a copyrighted educational video, a published patent, and has presented at national and international academic platforms, including AIMS and ILBS. He is known for blending academic rigor with clinical excellence and deeply committed to student mentorship and innovation nursing education. On behalf of Samarpan, I welcome you, sir, and the virtual stage is all yours. Thank you.
थैंक यू वेरी मच मैम। टुडे, first of all, thank to Dr. Deepti madam and Samarpan group of institute that for giving me opportunity to deliver the webinar. So today we will discuss the. Are you listening me? Are you listening me? I am audible. I am audible. Hello. Hello.
Yes, sir, you are audible, sir.
Okay. 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 So today we will discuss the emergency management of poison. My slide is visible. Hello.
Yes, sir, your
Okay.
slide is
Okay.
visible. Just
Okay. Okay. Thank you. Thank you very much. So today we will discuss the emergency management of the poison. First of all, we will discuss the what is the poison. So poison is a substance that kills or injures through its chemical action, which can damage the organ of digest. digestion, if absorbed into the blood, may affect the vital organ that can cause harmful action on the human body, injuries, health, and even death. So what is the poison? Poison is the substance like injuries जो हमारे इंक्रीज करता है एज ए केमिकल एक्शन which damage the organ of the digestion. जो organ of digestion को they can damage in our bodies and absorb in the blood may affect the vital organ and after that absorb the poison can affect the vital organs and example heart and brain. These are the vital organs. They can damage and they poison can damage the organs and injuries, health, and even death also may be occurs. Toxicology. What is the toxicology? This is the branch of medicine that deals with the detection and treatment of the poison. So we call the toxicology in the medicine department in which we will deals the detect the poison and treatment of the poison. Now definition. What is the definition of the poison? Poison represent the harmful effect on the human body. Poison जो है वो represent करता है harmful effect of the human bodies of accidentally or innocently exposure to the toxic amount of any substance. Next, there are the four routes of the poisoning. Number one है आपका inhalation. Inhalation में poison inhalation by the inhalation individual inhale the by the spray and containing fluids. So this is the routes of the inhalation poisoning and next ingestion. Ingestion how to ingestion poison can go by the injectable. Next ingestion so that poison can can enter by the ingestion. Ingestion बोले तो rat poisoning and drain cleaners. Individual if accidentally eating the rat kill rat poisoning. Next absorption. Absorption बोले तो this is the other route or four route of the poisoning. So it may be absorption by the skin and next the effect of the poisoning may be local effect may be occur and systemic effect. Both are occurs effects of the poisoning local and systemic both are effect of the poisoning. It may occur immediately and several hours and even days after the exposure. So it may maybe occurs immediately action हो सकता है next several hours के बाद effect आ सकता है next after exposure even day after exposure के बाद भी poison का effect हमारी body को हो सकता है. Next है आपका classification. What are the classification of the poison? Based on the origin base microbial poison. It involves microorganisms such as the bacteria, virus, fungus, parasite. These are the microbial base of poison. Plants. It involves the plants toxins such as the belladonna. Belladonna is the trees which originate the poison. Next, animals. In this poison is transferred through the bites and sting of the poisonous snake, scorpion, ants, and spiders. So these are the animals which originate the poison. Synthetic is other types of the synthetic poison. Synthetic, this involves the chemical that are produced through the chemists such as the pesticide and drug. So this is the synthetic poison which involves the chemical product. Based on the physical form, these are the involved chemical in the following form. Solid form, these are the physical forms. Solid forms, liquid form, vapors and aerosols. These are the physical forms of the poison are available in the markets. Next, what are the causes of the poisoning? Chemical causes of the poisoning, household, bleach, kerosene, industrial, methanol, ethanol, glycol, cyanide, arsenic, pesticide, organophosphate, organochlorines, DDT, or rat poisoning. These are the causes of the poisoning. therapeutic drug, overdose, example paracetamol, aspirin, iron tablet, nephedimine, phenobarbital. These are the drug, therapeutic drug, overdose poisoning. Toxic plants, poisonous mushroom also is the plants poisoning. Toxic herbal preparations. Next, bites and stings of the venomous animals, snake, scorpion, bees, spiders, and aquatic animals. These are the types of the animal poisoning. Next, what are the sign of the poisoning? First of all, fever will occur, vomiting, diarrhea, dehydration, jaundice, tongue discoloration, unusual fatal smell on breath, change in breathing rate or irregularities, change in the pulse rate and irregularities, skin lesions, abdominal tenderness will be there, change in the pupil size, small and large, both are there, changes small and large in the pupil size, and seizures may be occurs. These are the sign of the poisoning. What are the symptoms of the poisoning? Vomiting, diarrhea, upper abdominal pain, jaundice, difficulties, breathing, palpitation, skin disease, and scanty urine. Is the scanty urine the less than 300 urine output? That is scanty urine. What are the danger signs of the poisoning? No breathing, VG and nosy breathing, pulse below 50, and patient will go the bradycardia or above 110 beats per minute, and patient may be go the tachycardia. Irregular pulse will be there and very weak pulse will be there. Next, non-reacting pupils. Non-reacting pupils will occur in the poisoning case. Loss of consciousness. Patient will be a loss of consciousness in the poisoning case. Continuous seizures will occur in this condition. Temperature is elevated above than 39 degrees Celsius, mouth or rectum or 38 degrees Celsius armpit. Severe abdominal tenderness will be there, anuria will be there, or esteresis will be there. These are the danger sign of the poison. Next, what are the investigation will perform in the poison? TLC, total leukocyte count will be do. BUN and creatinine, electrolyte level will evaluate, liver function test will evaluate, fasting blood glucose will evaluate, toxicological analysis of the identified substance or tissue sample, gastric aspirate, we will send the toxicological analysis. Next, what are the treatment will provide to the poison patient? Treatment objectives, first to maintain normal vital sign. First of all, we have to maintain the normal vital sign of the poison patient. Next, number two, to decontaminate the site of the exposure. So we will do decontaminate site of the exposure. Site को जो exposure site है उसे decontaminate करेंगे. Number two, three है to prevent and reduce absorption. Prevent and reduce the absorption. Poison absorption we will reduce and prevent in the body to enhance elimination. तो poison को हम elimination करेंगे, enhance elimination करेंगे to relieve symptoms. What are the symptoms in the patient? We have to relieve from the symptoms. Next step to prevent further organ damage and impairment without delay. Without delay, we have to save the organs of the damage and impairment of the organ. Non-pharmacological treatment, ensure airway and patent. So first of all, we have to ensure patient airway and patent the airway. Remove contaminated clothing if necessary. Next, wash chemical away from the skin with soap and lot of water. Next, if necessary, perform nasogastric aspiration if airway is protected. If necessary, perform the nasogastric aspiration if airway is protected. Airway protected है तो we have to do the necessary nasogastric aspiration. Next, carry out the gastric lavage. So we have to do the gastric lavage and aspiration within the 1 hours after the events, and later if it involves slow release and highly toxic substance. So we have to do the gastric lavage within 1 hours in the events. Otherwise, patient will absorb the toxic substance. Next, detain the patient in the clinic and or hospital for close and continuous observation. We have to keep the patient in the hospital, clinic for close observation and continuous observation, re-evaluation and supporting or symptomatic treatment. Maintain the continuous monitor vital sign and maintain करना है continuous monitor vital sign of the patient. The patient is not going to bradycardia, patient is going to hypotension, so we have to maintain the vital sign of the patients. Pharmacological management, initially management for hypoglycemia, patient will go hypoglycemia. So first of all, we have to give the glucose IV 25 to 50 ml of 50% over 1 to 3 minutes. If patient is going to hypoglycemia, so we have to give the glucose 50%, 25 to 50 ml in the 1 to 3 minutes. Next, for overdose, opioid overdose में we have to give the naloxone IV, adult में 0.4 to 2 mg and repeat every 2 to 3 minutes, maximum dose of 10 mg. Next, children, in the children cases, 10 microgram per kg state and subsequent dose of the 100 microgram per kg if no response in initial dose. यदि initial dose में no response आ रहा है तो we have to give the 100 microgram per kg in the children's cases. Next, then naloxone, we can give the naloxone SC subcutaneous also we can give. IM intramuscular and IV route is not feasible. यदि IV route is not feasible तो SC and IM we can give the naloxone. Antidotes also we can give, used 5 to 10% because if less available, 5 to 10% antidotes इसमें यूज होता है because less available होता है. According to WHO, antidotes is defined is a therapeutic substances used to counteract the toxic action of a specific xenobiotic. Xenobiotic के specific action को counteract करने के लिए we have to give the antidotes according to WHO. इसमें आपका दे रखा है सपोर्टिव थेरेपी प्लस करेक्ट एंटीडोट्स, so we can survive the patient life. Physical antidotes agents use physical antidotes agents used to interfere with poison through physical properties, not change their nature. Number one, absorbing, the main example of the activated charcoal. Number two, coating, a mixture of egg and milk made a coat over the mucosa, dissolving 10% alcohol or glycine or carbolic acid. So these are the physical antidotes. Next, types of the poisoning. Types of the poisoning में we will discuss the ingest solo poisoning. Ingest solo poisoning में soloid poisoning may be kerosene. जो soloid poisoning है वो may be kerosene हो सकता है. Kerosene poisoning include the alkaline and acid agents that can the cause tissue destruction after coming in the contact of the mucous membrane. Next, alkaline products. What is the alkaline products of the kerosene poisoning? Drain cleaners, toilet bowl cleaners, bleach or non-phosphate detergent, oven cleaners, and bottom batteries are the alkaline products. Next, acid products. What are the acid products of the corrosive poisoning? Toilet bowl cleaners, pool cleaners, metal cleaners, rust junk remover, and battery acid are the acid products of the kerosene poisoning. Next, petroleum distillates, hydrocarbons, kerosene, turpentine. These are the corrosive poisoning, drug overdose, and food poisoning. These are the types of the drug overdose poisoning or food poisoning. What are the management of the kerosene poisoning? Check and maintain the ABC. First of all, we have to check and maintain the ABC. Airway, breathing, circulation, we have to maintain and stable the vital sign of the patient. Next, check and analysis of the ECG. What are the changes of the ECG? We can check and analyze the ECG. Next, assess neurological status. We have to check the GCS and assess the neurological status. How much of the GCS we have to assess. Next, give water and milk to drink for dilution of strong acid and alkaline poison. Give water. We will have to give the water and milk to drink for dilution of the strong acid or alkaline poison in the stomach. We have to give the water milk. Next, gastric emptying procedure. What are the gastric emptying procedure? We have to do the gastric emptying procedures for the poisoning cases. Syrup of ICS to induce vomiting to alert patient. Never use with corrosive poisoning. We have to give the syrup IPCs, IPCs to induce the vomiting or never give in the corrosive poisoning. Corrosive poisoning में we will not give this syrup. Next, gastric lavage for the obtained patient. Gastric aspirate is saved and sent to the laboratory for the testing of the testology screening. So we have to do the gastric lavage, and after get the sample of the gastric lavage, aspirate of the gastric lavage, we have to save and send to the laboratory for testing of the toxicology screening. Activated charcoal administration 1 gram per kg. So we have to administer the charcoal administration because charcoal will absorb the poisoning in the stomach and he will absorb the poisoning in the stomach and after that poisoning will not dilute in the blood, so that we will use the activated charcoal administration. Catholic and then appropriate we have to administer the sorbitol 1 to 2 gram per kg, sodium sulfate and magnesium citrate. We have to give the Catholic, we have to give the NG2 by the these medicine of the NG. If there is specific antidote, so then administer it is early as possible. If there is specific antidote is there, so we have to administer early as possible to save the patient life. If antidote is not available, so then remove the ingest material by the administration of the charcoal, dialysis or hemoperfusion. Now, hemoperfusion, what is the hemoperfusion? Involves the detoxification of the blood by processing it through the extracorporeal circuit and an adsorbent cartilage containing charcoal and after which clean the blood in return in the patient. So hemoperfusion, we have to do the detoxification of the blood by the dialysis and by the charcoal resin. Next, carbon monoxide poisoning inhalation. Carbon monoxide poisoning is the liquid gas which will inhale the patient and patient will go coma. Carbon monoxide poisoning may be occur as a result of the industrial and household incidents and attempted suicide. The carbon monoxide poisoning may occur in the industrial areas and attempt to the suicide. Carbon monoxide is bound HB called carbo-oxy hemoglobin does not transport the O2. Carbon monoxide bound करता है HB call में तो carbo-oxy carboxy hemoglobin में or does not transport the oxygen. So it is not transport the oxygen in the body. Sign of the carbon monoxide. Carbon monoxide, what are the sign of the poisoning? Headache, nausea, breathlessness, collapse, dizziness, and loss of consciousness. These are the sign of the carbon monoxide poisoning. Clinical manifestation. What are the clinical manifestations of the carbon monoxide? CO. Number 1, headache. Headache will occur. Muscular weakness will occur. Palpitation will occur. Dizziness also will occur. Confusion progresses towards coma. Skin color blue, flash reading and pulse reading and pulse oximeter. So false reading of pulse oximeter. This is the clinical manifestation of the carbon monoxide poisoning. What are the management of the carbon monoxide poisoning goals? What are the goals of the management? To reserve cerebral and myocardial hypoxia. So we have to reserve the cerebral myocardial hypoxia in this condition. What are the intervention of the carbon monoxide poisoning? Carry the patient to the fresh air immediately. Open all the doors and windows immediately. Loosen all the tight clothing. Initiate the CPR if required. If required, so we have to start the CPR and administer the 100% O2. Next, prevent chilling. Wrap the patient in the blanket. If patient is feeling the shivering and chilling, so we have to wrap the patient in the blanket. Next, keep the patient as quiet as possible. Next, don't give alcohol in any form or permit the patient to smoke. So in this condition, we don't use the alcohol and don't permit the patient to smoke. Next, आपका skin contamination poisoning exposure. So how to absorb the poison by the skin? We will discuss skin contamination injuries from exposure to chemical. Skin contamination injuries from the exposure to chemicals are challenging because of the large number of possible opening agents with diverse action and metabolic effect. So this is the challenging because the large number of possible opening agents, diverse action and metabolic effect will be there. Next, the severity of the chemical burns is determined by the mechanism of the action. So severity of the chemical burn determined by the mechanism of action. We will determine by the mechanism of action, the penetrating strength and concentration of the poison and the amount of duration of exposure of the skin and chemical. So we have to determine the amount of duration of the exposure of skin to the chemical. Management was the management of the skin inhalation poison was to prevent skin from exposure. So we have to prevent skin from exposure to the poison areas. Intervention, first of all, wash the exposed skin thoroughly with water. So we have to wash the skin, affected skin thoroughly with water. Water should not be applied on the burn from lye and white phosphorus because the potential potential for an exploration or depending the burn area. So don't water should not be applied to the burn from lye area. So don't apply the burn area or burn area by the waters or white phosphorus because the potential for explosion or the dipping of the burn. All evidence of these chemicals should be based off the patient before any placing occurs. All evidence जितने भी evidence है of the chemical should be बेसिक होनी चाहिए of the patient before placing occurs. Start with standard burn treatment according to the site and location of the wound and antimicrobial treatment, debridement, tetanus prophylaxis, antidotes, administration as prescribed. So start the standard burn treatment according to the site and location of the wound. Plastic surgery may be required for the management of the wound. Next, organophosphorus poisoning. So what are the organophosphorus poisoning? Is the types of the poisoning. Organophosphorus poisoning, poisoning, organophosphorus poisoning compounds are a diverse group of the chemicals used in the domestic and industrial setting. Which are the used in the domestic and industrial setting? We will call the organophosphorus poisoning. The sign and symptom of the organophosphorus poisoning can be divided into three broad categories: muscarinic effect or nicotinic effects and CNS effect. Sign of the muscarinic effect of the organophosphate salate. Salate में salivation will be there and lacrimation will be there. Urination also will be there. Diarrhea will be there. GI upset will be there and emesis will be there in the mucineric effect of the organophosphorus poisoning. Next, dumblings it will be there. D means diaprosis and diarrhea will be there. urination will be there. Next, meiosis will be there. Next, bradycardia and bronchospasm will be there. Emesis will be there. Excessive lacrimation will be there, and salivation will be there. Dumbbells, dumbbells is there. Next, what are the narcotic sign and symptoms of the organophosphorus poisoning? Number one, muscle fasciculation, cramping of the muscles, weakness. Next, diaphragmatic failure. Next, autonomic narcotic effects include hypertension will be there, tachycardia will be there, mydriasis will be there, and pallor will be there. This is the autonomic narcotic effects. Next, CNS effect. What are the CNS effect of the organophosphate poisoning? Anxiety will be there, emotional lability will be there, restlessness, confusion, ataxia, tremors, and seizures, and coma will be there in the organophosphorus poisoning. Next, what are the treatment of the medical care in the organophosphorus poisoning? Airway control and adequate oxygenation are paramount in organophosphate poisoning. So we have to give the airway, we have to clean the airway and airway control and adequate oxygen supplement we have to give to the patient. Next, intubation may be necessary. If necessary, so we have to do the intubation in the cases of the respiratory distress due to laryngospasm. Laryngospasm की वजह से respiratory distress, if patient is going to respiratory distress, so with respiratory failure, we have to do the intubate the patient due to bronchospasm or broncholia and seizures condition. We have to do the intubate of the patient in the organophosphorus poisoning. Next, immediate aggressive use of atropine may eliminate the need of intubation. So we have to immediate aggressive use of atropine. Atropine हमें use करना है by the eliminate the need of intubation. Next, chlorine sodium is avoided because the degrade by the acetylolinase and may result of the prolonged paralysis. So succinylate should be avoided. This medicine we will avoid it in this organophosphorus poisoning. Medication, what are the medication will be in the organophosphorus poisoning? The maintained stage of the medical therapy organophosphorus poisoning including the atropine, pyrrolidocin or tidapam we will use in the organophosphorus poisoning. Initial management must focus on adequate use of atropine. शुरुआत में भी in the starting phase we have to use the focus of atropine optimizing oxygen prior to the use of atropine is recommended to minimize the potential by the dysarrhythmias. So we will use the atropine to minimize the potential dysarrhythmias. We will use the atropine. Next, anticholinergic agent. We have to use the anticholinergic agent. These agents at the competitive antagonist at the muscarinic cholinergic receptors in the both central and peripheral nervous system. So these are the agent is competitive antagonist है जो कि muscarinic cholinergic receptor both central और peripheral nervous system को स्लो करेगा. Next, these agents don't affect narcotic effects. So these agents will not affect on the narcotic effects. Atropine isotope or atropine isotope or atropine adults. What are the dose of the adults? 1 to 2 mg bolus repeat and 1 to 5 minutes for deserve effect drying and pulmonary circulation and education also. So we have to give the 1 to 2 mg bolus unit and after that 1 to 5 repeat this dose after 1 to 5 minutes and for deserve effects drying of the pulmonary circulation and adequate the oxygen saturation in the body. Strongly consider doubling each subsequent dose for repeat rapid control of the patient's severe respiratory. So this is the strongly consider doubling of the each subsequent patient rapid control of the severe respiratory test condition in the adult we will give to 1 to 2 mg bolus and after repeat. And pediatric condition, we have to give the atropine 0.05 mg per kg IV and repeat 1 to 5 minutes PRN for the control airway situation. Strongly consider doubling each subsequent dose of the rapidly stabilized patient with the severe distress. Next, we will discuss the snake bites and its management. What are the snake bites and its management? What is the epidemiology of the snake bite worldwide? While reliable data are hard to obtain, it has been estimated about the 5 million snake bites occurs each year, resulting in up to 2.5 million in phenomenon at least 1 lakh death and around 3 times as many amputation and other permanent disabilities. So these are the epidemiologies incidence of the data. Next, after India's the peak incidence of the snake bite cases is reported during the paddy sowing and harvesting periods जून के उसमें बहुत ज्यादा स्नेक बाइट्स के केसेस मिलते हैं. द कॉमन क्रिएट बुननेस careless and is regarded regarded as the most dangerous species of the venomous snake in the Indian subcontinent. What are the classification of the snakes? These are the families of the snakes in the India. Poisonous snakes belong to the three broad families. Number one, Alepidae, cobras and create. Next, number two, Vipridic, vipers, Brussels, vipers, saw-scaled vipers, pit vipers. These are the second family of the snake. Next, हाइड्रोपिटिक सी स्नेक जो कि समुद्र में स्नेक रहता है उसे हाइड्रोपिक फैमिली से बिलोंग करते हैं. तो दीज आर द थ्री फैमिलीज ऑफ द स्नेक. नेक्स्ट, poisonous snake can be identified by their characterized morphology. So how to identify the poisonous snake? By the characterized by the morphology. Morphology से ही snake को पहचाना जा सकता है. Next, classification of snake. Poisonous snakes belong to the three families: Elapides, Vipridies, and Hydrophobia. Next, when the venom has been injected, the local symptoms and signs in the bitten part. So how to identify the snake bite? We will discuss. Number one, fang mark. So fang mark, we will see the fang mark of the snake. So which type of the fang mark of the snake on the body we will see. Next, local pain. We will analyze the local pain and local bleeding. Also, breathing है नहीं है उसमें वो देखेंगे. Lymphangitis, lymph node enlargement, inflammation. We will see the inflammation, swelling, and redness and heat. 3 hours and the sign of the inflammation. We will see the on bodies. Blistering. We will see also local infection and abscess formation. Also, we will see next necrosis. We will see the death of tissue. We will see the snake bite sign. Now, general symptom of the snake bite. What are the general symptom of the snake bite? Number one, central nervous system. What are the changes of the central nervous system? Number one, dizziness will there, fainting will be there, increased thirst will be there, and headache will be there in the snake bite. Next, systemic what are the changes of the systemic? Fever and severe pain will be there. Next, respiratory. What are the changes of the respiratory in the snake bite? Next, breathing difficulty will be there. Dyspnea will be there. Next, wound side. What are the changes of the wound side? What are the changes of the wound side? Bleeding will be there in the wound side. Fang mark will be there. of the wound side, discoloration will be there, burning sensation will be there, or swelling will be there in the wound side. Other skin side, what are the changes of the other skin side? Bleeding spot, numbness, tingling, sweating are in the other side of the skin side. Vision, what are the vision changes of the snake bite? Bluishness, bluishness was me. Next, heart and vessels may rapid pulse and low blood pressure, hypertension will be there, or severe so will be there. Patient may go to the shock condition. Next, muscular convulsions, loss of coordination and weakness. So, what are the changes of the muscular system? Convulsions will be there, loss of coordination will be there, weakness will be there. Next, gastric. What are the gastric changes in the snake bite? Nausea and vomiting will be there. Next, intestinal diarrhea will be there. So, these are the changes, these are the general symptoms of the snake bite in our bodies. Next, poisonous and non-poisonous snake. So what are the symbol? What are the identification of the poisonous or non-poisonous snake? So number A, fank mark. Fank mark will be there. This type of the fank mark will be there. The bites of the most poisonous snake leaves mark of the two fangs. Two fank mark will be there, and sometimes little mark made by the other teeth. So sometimes little mark made by the other teeth. So two fang mark will be there in the poisonous snake. Next number B. B may the bites of the snake that is the not poisonous leaves only two row of the teeth mark, but no fang mark is there. So two row will be there, but no fang mark is there in the non-poisoning snake. These are the fang mark of the poison snake. Next, non-poisonous snake bite puncture mark. So these are the four puncture mark is there in the non-poisonous snake bite, and two puncture mark in the snake bite of the poisonous. Poisonous snake bite will give the two marks of the puncture. Next, initial first aid. What do it right? Do it right. What is the means of the right? What is the means of the right? R means reassures the patient. 70% of the snake bite are from venomous species. Only 50% of the bites by the venomous species actually envenomate the patient. So 70% are the all snake bite are the non-venomous species. Only 50% are the venomous species is there. Next, I immobilize the same way as a fractured limb. So we have to immobilize the part of the injured part by the snake, same as a fractured limb. Use bandage or cloth to hold the splint. We have to use the bandage and cloth to hold the splint, and not to block the blood supply or apply pressure. So don't block the blood supply of the part or any pressure of the injured part. Don't apply the any compression in the form of the tight ligature, and then they don't work and can be dangerous. So don't apply the any compression in the form the tight ligature, tight pressure बांधना नहीं है, और they don't work और इस पे काम नहीं करना, can be dangerous. तो ये can be dangerous हो सकता है. You are tying the part of the above part of the injured part, so it can be dangerous. Next, GH will get to hospital immediately. If you identify the snake bite is there, so you have to get the hospital immediately. Traditional remedies have to no provision benefit to a treating snake bite. So traditional remedies there is no provision to benefit the treating snake bite. Next, tell tell the doctors of any synthetic symptoms such as ptosis that manifest on the way of hospital. Next, Snake bite treatment protocol. What are the protocol of snake bite treatment? Patient assessment phase. On arrival, patient assessment phase. On arrival, deal with any life-threatening symptoms on the presentation. So we have to deal with any life-threatening symptoms on the presentation. We have to maintain the ABC, airway, breathing and circulation. We have to maintain the snake bite patient. If there is evidence of a bite where the skin has been broken, so we tetanus toxoid. So if there is evidence bite or skin broken has been there, so we have to give the TT, tetanus toxoid injectable we have to give. Next, routine use of antibiotics is not necessary, although it should be considered if there is evidence of the cellulitis or nephrosis. So routine antibiotic will not necessary. If there is any cellulitis or nephrosis will be there, so it should be antibiotics should be considered in this condition of the standard. Specific RSASV anti-snake vaccine, polyvalent antivenom is available in the lipolysed, lipolysed form. So as liquid antivenom is unstable at the room temperature, so we will give the polyvalent antivenom is available. We have to give the patient ASV anti-snake vaccine active against the four common poisonous snake in the India. So active agents in the four common poisonous snake in the India: cobra, carrot, lucerne, vapor, and sa scaled vapor. We have to use the polyvalent antivenom vaccine in this condition. Average potency of the antiserum available each that 1 ml will be neutralized. So average, what is the average potency of the anti-serum average available in the 1 ml will be neutralized. 0.6 mg cobra, 0.45 mg carrot, and 0.6 mg Russell vapor, and 0.45 mg soft scaled vapor manually. Next, reconstitution involves the addition of 10 ml of diluted water to an ampoule and shaking till the solution is clear. So we have to dilute the 10 ml water and reconstitution of the involved at the 10 ml water and shake the ampoules and see the clear solution of the medicine. Next, if should be administered intravenously as early as possible. If should be intravenously as early as possible, so it is essential to ensure about allergy, especially to our hot serum. It will it is well to be prepared for the anaphylactic reaction during the antivenom administration. So it should be administered intravenously. We have to early possible, or we have to prepare an essential inquiry and prepare what are the allergy special horse serum. So it will be a prepare for anaphylactic reaction. Polyvalent antivenom is there. This is the vial of the polyvalent antivenom antidotes. Specific RS ASV standard high dose, loading dose of the 100 ml, followed by 50 ml every 6 hours till the floating time became normal. So we have to loading dose of the 100 ml and followed by the 50 ml every 6 hours. Low dose, this is the standard dose. Next, low dose, the basis of the low dose therapy is that the venom is absorbed only gradually into the systematic circulation, and the low dose is significant to neutralize the absorbed quantity of the venom. The low dose is given over a longer period as a absorption of the venom continues into the systemic circulation. So low dose is given over longer period. So we have to give the standard dose, loading dose in the initial stage of the step by. Supportive RS, what are the supportive treatment we will give in the snake bite condition. Number one, analgesic for the pain, tablet PCM we have to give, and Comiplan we have to give, also give antibiotic for infection, so we can give the antibiotic for infection. The choice should cover for the anaerobic infection, so it will be a choice to cover the anaerobic infection. Next, anti-tetanus prophylaxis will be there. We have to give the TT injection, anti-tetanus prophylaxis we have to give. Next, replacement of the coagulation factors, replacement of coagulation factor and platelet if there is active significant bleeding and bleeding into the vital organ will be there. So we have to give the coagulation factors, replacement of coagulation and the platelet we have to give the in bleeding condition, active bleeding condition. Management of the management of complication. What are the management of complication? Respiratory failure. Respiratory failure में hydropionium, atropine 10 mg and 0.6 mg as a test. Neostigmine, atropine 5 mg and 6 mg every 30 to 60 minutes. Mechanical ventilator we can take the patient on the mechanical ventilator in the respiratory failure condition. Next, shock. Treat as a appropriate. If patient is going to shock condition, we have to take the appropriate. Next, renal failure. If patient is going to the renal failure by the snake bite, so we have to shift the patient for dialysis before the detoxification of the poisoning from the blood. Next, tight arterial tourniquet are not recommended. Tight arterial tourniquet are not recommended in this snake bite condition. To be effective, these had to be applied around the upper part of the limb so tightly that the peripheral pulse was occurred. So to be effective, these had to be applied. यदि आप applied कर रहे हैं around the upper part of the limb, तो so tightly, यदि ज़्यादा tight कर रहे हैं तो we peripheral pulse was occurred. So in this condition, peripheral pulse was occurred in this condition tight of the upper limb of the body. Next, this method was extremely painful. This method are extremely painful and very dangerous if the tourniquet was left on for too long, more than 40 minutes. यदि 40 minutes से ज़्यादा आपने tourniquet will be there, so it is a dangerous and painful for the patient. And as the limb might be damaged हो सकता है by the ischemia, gangrene limb there. By the ischemia, gangrenous limb will be there if you are applying the tourniquet, tightly tourniquet more than 40 minutes. Next,
Sir, your voice is not hearing.
just wait, sir. I am saying, okay. Next,
Okay.
confining this toxin in a smaller area. We have to confine the toxin in a smaller area. So by the use of the compression technique creates a greater risk of the serious local damage. So we have to use the compression on technique or creates a greater risk for serious local damage. तो उसे greater risk को कम कर सकते हैं हम local damage को. This is the compression technique will be there. No tight. Next, when the tourniquet is removed, where there is the problem of the venom rapidly entering the system and causing rapidly failure in the cause of the neurotoxic bites. When the tourniquet is removed, जब tourniquet remove करते हैं, when the problem is the venom rapidly enter, so problem will be there. Venom rapidly enter in the system, causing the respiratory failure. So don't tie the tourniquet of the snake bite areas. Next, the Russell Viper venom contains pro-coagulant enzymes which cause the blood clot. जो blood clot के लिए responsible होता है in the small space below the tunicate, the venom has great chance of the poison of the load. So tunicate will with the great chance of the venom clot will be there. When the tunicate is released, the clot will rapidly enter in the body. When the tunicate will release and venom clot will be rapidly enter in the body and then cause the embolism and death of the patient. So don't tie the tunicate of the snake bite patient. Lastly, there has been great deal of the research showing that tunicate don't stop venom from entering the body. This is the don't stop venom of the enter body. So don't tunicate of the snake bite areas. What are the nursing management? Assessment, assess the condition of the patient, assess the type of the type of the poisoning, assess the more injured area. This is the nursing management. You have to assessment of the type of the patient, type of the poisoning and injured area. Next, goals. What are the goals? Early detection, early management, and prevention of the complication. This is the goals of the nursing management. Thank you. So, yeah, we will discuss the snake bites and poison also in this PPT. Now, other condition we will discuss. Heat stroke. Other condition we will discuss the heat stroke. Nowadays, heat stroke is more going in the our areas, UP's area in all in our India. So what is the heat stroke? So everybody should know the what is the heat stroke, what is the management of the heat stroke. Everybody should know. So now, what is the definition of the heat stroke? Now, what is the heat stroke? Heat stroke is a condition caused by your body overheating, usually as a result of prolonged exposure to or physical exertion in the high temperature. So heat stroke, this is a condition caused by the if your body is overheating, usually in the result of the prolonged exposure of the physical or exertion in the high temperature. If you are working in the high temperature and by the prolonged time, so you can get the heat stroke condition in our bodies. So this most serious form of the heat injuries, heat stroke can occur if your body temperature rise to 104 degree Fahrenheit, 40 degrees Celsius or higher. So this is the most serious condition will be occurs heat injury, heat stroke if you are doing if your body the temperature is raised 104 Fahrenheit and 40 degrees Celsius. So it means you have to maintain the body temperature less than 40 degrees Celsius. So that's why you prevent the heat stroke. Heat stroke, heat illness. What are the heat illness? Heat cramps will be there. Excessive, if you are working in the excessive heat area, so heat cramps will be there. Next, heat edema will be there. If we are working in the excessive heating areas, so our body's blood vessel will be dilated and dilated, and after that, heat edema will be there in the feet. Next, heat races will be there. Next, heat syncope will be there in the higher temperature. If we are working, we are playing in the higher temperature, the heat syncope will be there. Next, heat exhaustion and heat stroke. What is the heat exhaustion and heat stroke? So before going to the heat stroke, we have to prevent the heat exhaustion. So heat exhaustion मतलब फैंट हीट एग्जॉशन फैंट एंड डिजीनेस होगा हीट एग्जॉशन में excessive sweating will be there, cool and pallid and clammy skin will be there, nausea and vomiting will be there heat exhaustion में. Next, heat stroke में trembling headache will be there. Next, no sweating will be there. Next, body temperature above 103 degrees Celsius, red, hot and dry skin will be there. Next is the body temperature will be above 103 degrees Fahrenheit. Next, nausea and vomiting will be there in the heat stroke condition. To prevent the heat stroke condition, we have to prevent the heat exhaustion. What are the classification of the heat stroke? Classification of the heat stroke, non-gestational heat stroke, more common in the younger children who are unable to escape from hot environment and those with underlying chronic medical condition that impaired thermoregulation. The more common non-gestational heat stroke in this condition will occur the more common in younger children who are unable to escape the hot environment. जो unable रहते हैं escape करने के लिए hot environment को and those underlying chronic medical condition जो medical condition से ग्रस्त हैं impair the matter thermoregulation that will do the impaired thermoregulation that is known as gestational heat stroke. Additional heat stroke generally occurs when the healthy individual who engage the heavy exercise when जो healthy individual है जो heavy exercise में engage है during the period of the high temperature or humidity areas. So examples athletes और military requirement basic training. तो इसमें athletes में और military requirement में this is a basic training हो चाहिए होती है इसलिए adjustment heat stroke इनमें हो सकता है. Next, heat adjustment and heat stroke. Heat adjustment or heat stroke are the part of the continuum of the heat-related illness. This is the part of the heat-related illness. Both are common and preventable condition affecting diverse patient. So both are common. Preventable ही है और common भी है preventable भी condition है affecting diverse patient. Next, recent research has identified cascade of inflammatory pathogenic events that begin with the mild heat ingestion and if uninterrupted, so it can be eventually multi-organ failure and death. So many research identify that if the inflammatory pathogen is there, so we have to it begin the mild heat ingestion. If we are not treated the mild heat ingestion, so it can be failure of the multiple organ and death will be there. Heat adjustment is characterized by the non-specific symptom such as malaise, headache and nausea. तो heat adjustment characterized होता है non-specific symptom के द्वारा such as the malaise होगा and headache or nausea. Next, untreated heat adjustment can be progressive to heat stroke. Untreated heat adjustment can be progressive heat stroke and much more serious illness involving central nervous system dysfunction and such as the delirium and coma. So patient, if patient is not taking the heat adjustment treatment, the patient will go to the heat stroke and patient's nervous system will be a dysfunction such as the delirium and patient will go to the coma condition in this heat adjustment condition. Who are the risk persons will get the heat stroke? Elderly people easily get the heat stroke. Children also get the heat stroke. Athletes who are playing in the highly temperature area. Next, military soldiers, they can get the heat stroke and outdoor workers, building construction and roofers, they can easily the heat stroke because they are doing work in the highly temperature areas. These are the person will get the heat stroke. Risk factors. Heat stroke is mostly likely to affect the older people who live in the apartment or homes that don't have air conditioning or good airflow. तो हीट स्ट्रोक मोस्टली लाइकली द ओल्डर पर्सन में ज्यादा होता है जो कि अपार्टमेंट में रहते हैं और दे डोंट हैव द एयर कंडीशन और गुड एयर फ्लो इन द अपार्टमेंट. अदर हाई रिस्क ग्रुप इंक्लूड द पीपल ऑफ एनी एज हु डोंट ड्रिंक द इनफ वाटर, जो कि इनफ वाटर गर्मियों में नहीं ले रहे हैं, इलेक्ट्रोलाइट मेंटेन नहीं कर रहे हैं, तो अदर पीपल कैन गेट द हीट स्ट्रोक. Next, have a chronic disease. Whose patient have a chronic disease condition, they get the heat stroke, and or who drink the excessive amount of alcohol. Whose person are taking the excessive amount of alcohol, they can get the heat stroke easily. Heat stroke is strongly related to the heat index. तो heat stroke जो है वो strongly related है to the heat index, which is a measurement of the how hot you feel. जो कि हीट इंडेक्स जो मेजरमेंट करता है हाउ हॉट यू फील व्हेन द इफेक्ट ऑफ द रिलेटिव ह्यूमिडिटी और एयर टेम्परेचर आर कंबाइंड. जब एयर टेम्परेचर और रिलेटिव ह्यूमिडिटी का इफेक्ट आता है तो हाउ मच हीट यू आर फीलिंग, इट इज मेजरमेंट बाय द हीट इंडेक्स. दिस इज द हीट इंडेक्स will measure the environment temperature or environment humidity. A relative humidity of the 60% or more hampers sweat evaporation. यदि relative humidity more than 60% है, तो more hamper sweat evaporation will be there, which hinders your body ability to cool itself. जिसमें कि हमारी हमारी जो बॉडी है वो अपने आप ही कूल हो जाती है if humidity is of the 60% in the environment. Risk factors में the risk of the heat related illness dramatically increase when the heat index climbs up to 90 degrees or more. So it's important, especially during the heat waves, to pay attention to reported the heat index and also the remember the exposure to full sunshine when increase the reported of the heat index by the 15 degrees. So this is the risk of the heat related illness dramatically increase the 90 degrees. If heat index is showing the 90 degrees, 90 degree is above, so we can save the patient life. We can save the individual. Next, heat stroke sign and symptoms. What are the sign symptoms of the heat stroke? Include high body temperature will be there. A core body temperature of 104 degree Fahrenheit and 40 degree or higher. So this is the high body temperature will be there in the heat stroke sign and symptom. And obtain with a rectal temperature thermometer, we have to take the core temperature by the rectal thermometer. It is the accurate temperature of the body. Core temperature we will accurate finding is the main sign of the heat stroke. So we have to obtain the temperature by the rectal thermometer is the main sign of the heat stroke. If body temperature is above, core body temperature is above 104 degree Fahrenheit and 40 degrees Celsius. Altered mental status or behavior in this condition, in this heat stroke, altered mental status और behavior जो है वो altered हो जाएगा, mental status altered हो जाएगा. Next, alteration in the sweating will be altered. Next, nausea and vomiting will be there. Flushed skin and dry skin will be there. Next, rapid breathing will be there. Next, racing heart rate and pulse rate will be different. So racing heart rate हो जाएगा. Next, headache will be there. Next, seizures may be occurs in the heat stroke and patient may be go into the syncope unconscious condition in the heat stroke. Next, what are the diagnostic evaluation? Rectum temperature to check your whole body temperature. A rectum temperature is the most accurate way of the determine the your whole body temperature and is more accurate than mouth or forehead temperature. A blood test to the check blood sodium, potassium, electrolytes of the electrolyte of the body and the content of the gases in your blood to see if there been damage to the your central nervous system. So we have to evaluate the sodium, potassium, and the content of the gases in the blood to see the damage of the central nervous system. Number third, a urine test to check the color of the urine because it is usually darker if you have a heat-related condition. If you are having a heat stroke, heat-related condition, so your urine will be a darker, not light to check your kidney function. So you have to check the kidney function, which can be affected by the heat stroke. Next, muscle function test we test to check the serious damage to your muscle tissues, hemodialysis, X-ray, and other imaging tests to check the damage to your internal organ. So we can do the X-ray or other imaging. We can do the check the internal organs. What is the first stage of the heat stroke? So first of all, first aid treatment for victim of the heat stroke, including moving the clients to the cooler areas. So cooler environment may you have to take the patient and next reducing clothing, covering the body clothing we have to reducing and remove the clothing covering the body. Next, placing the wet towel over the skin. We have to apply the wet towel over the skin and using oscillating fan, which fan will give in the wet air fans to the increase convective heat loss. जो इंक्रीज करता है कन्वेक्टिव हीट लोड को कम करने के लिए वी विल यूज द ऑसिलेटिंग फैन. Next, if you are suspect that someone has a heat stroke, so immediately you have to call 911 or take the person to a hospital. Any delay seeking medical help can be fatal. If यदि आप डिले करते हो तो मेडिकल हेल्प में डिले होता है तो इट कैन बी फैटल हो सकता है, घातक हो सकता है. So you have to
Excuse
immediately.
me. Hello.
Yes,
Excuse
ma'am.
me, sir.
Yes, ma'am.
Sir, kindly make it slideshow.
स्लाइड नहीं आ रही है.
नो नो सर, स्लाइड शो कर दीजिए. एक्चुअली आपने किया था वो, आपकी स्क्रीन दिख रही है लैपटॉप की.
ओके ओके 2 मिनट.
फुल स्क्रीन कर दीजिए.
फुल स्क्रीन कर दीजिए सर, फुल स्क्रीन.
ओके ओके. It is visible now.
सर थैंक यू सर, थैंक यू सो मच.
Okay. If you are suspect that someone has a heat stroke, so immediately you have to call the 911 and take the person to a hospital. If any delay seeking medical help, so can be fatal. यदि medical help आने में delay हो रहा है तो patient will be a fatal condition. While waiting for the paramedics to arrive, initiate first aid, move the person to an air conditioned environment and or at least the cool environment and shady area. We have to move the patient and remove any unnecessary clothing of the patients. If possible, next, if possible, take the person core body temperature and initiate first aid to cool it to 101 to 10 degree Fahrenheit. If no thermometer are available, so don't hesitate to initiate first aid. If thermometer नहीं है तो we will don't hesitate. You can start the first aid. Next, medical management. Heat stroke. Next, heat stroke is the medical emergency and continues to be one of the leading causes of the preventable death in sports. So heat stroke is the medical emergency and continues to be one of the leading causes of the preventable death in sports. Next, rapid reduction of the core body temperature is the cornerstone of the treatment because the duration of hyperthermia is the primary determinant of the outcomes. So rapid reduction of the core temperature is the counterstone treatment है, or because of duration of the hyperthermia is the primary determinant of the outcomes. Next, patient diagnosed with additional heat stroke (EHS) or non-additional heat stroke and EHS should be admitted to the hospital for at least 48 hours to monitor for the complication. Next, once the heat stroke is suspected, so cooling must be begun immediately and must be continued during the patient resuscitation. Next, the American College of the Sports Medicine recommended that the cooling is initiated at the skin before transporting the patient to the emergency department for further evaluation and treatment. So before transporting the patient, you have to start the cooling of the patient at the initial stage. Next, emergency medical treatment may be include hypothermia, blanket, or intravenous fluids. Next, irrigating the stomach and lower bowel with cool solution. We have to reduce the temperature by the internal organs. So we have to do the irrigate the stomach and lower bowel with the cool solution. Next, treatment involves monitoring the patient in a cool, steady environment and ensuring the adequate hydration. Next, immediate cooling through the evaporation or full body ice water immersion the crucial. If you are doing the immediate cooling evaporation, so it will be a crucial for the patient. Next, physician also must monitor electrolyte abnormalities in this condition, heat stroke. So physician will measure the electrolytes, sodium, potassium, calcium. Be alert to the sign of the renal and hepatic failure. तो अलर्ट करने के लिए साइन ऑफ द रीनल फेलियर को इवैल्यूएट करने के लिए वी फिजिशियन विल ऐड द इलेक्ट्रोलाइट्स एंड रिप्लेस फ्लूइड इन द पेशेंट विद हीट स्ट्रोक और पेशेंट में फ्लूइड को रिप्लेस करने के लिए डॉक्टर फिजिशियन विल इवैल्यूएट द सीरम इलेक्ट्रोलाइट्स abnormalities. Next, medication have shown little efficiency in treating heat stroke. Medication have shown little efficiency. Little efficiency is showing the medicine in the treating heat stroke. Muscle relaxants such as the benzodiazepine and neuroleptic agents such as the chloromethadine, chlorpromazine, thyroidine have been used to inhibit the shivering and prophylaxis agent seizures, but clinical trials are lacking. So we will give the muscle relaxant such as the benzodiazepine or neuroleptic agent to control the seizures and shivering. Next, dentulium has proved ineffective in the decreasing core temperature. So dentulium have proved हो गया कि ineffective होता है decreasing the core temperature. Next, antipyretic agent will give while the theoretically useful in the combining the acute phase, recent response have not been evaluated for this use. So we have to use the antipyretic agents. Next, cooling usually is discontinued once the core temperature has reached 38 degrees Celsius. So we have to stop the cooling when the body temperature is reduced and reached to 38 degrees Fahrenheit, 100.4 degrees Fahrenheit or 38 degrees centigrade. We have to stop the cooling and third close monitoring should be continuing and third close monitoring will be continuing. Next, lifestyle and home remedies. If lifestyle and home remedies, if you notice sign of the heat-related illness, so lower your body temperature and prevent your condition from the progressing to the heat stroke. In a major heat emergency, so such in a major heat emergency such as heat cramps or heat exhaustion, so the following steps may lower your body temperatures. Next, get to the shade and air conditioned place if the If you don't have air condition at home, so go the some palace with the air conditioning, such as the mall, movies, theater, and public libraries. We can keep the patient in the areas if lesser heat emergency is there. Next, cool off the damp sheet को cool कर देते हैं. A fan को if you are with the someone who has experienced heat related symptoms, जो कि heat related symptoms है, तो cool the person by the covering him or her with the damp sheet से cover करते हैं हम उसे कूल कर सकते हैं पेशेंट को बाय द स्प्रेइंग विद द कूल वाटर को स्प्रे करते हैं एंड डायरेक्ट एयर ऑन टू द पर्सन विद द फैन और डायरेक्ट एयर ऑन टू द पर्सन विद द फैन के सामने उसे बैठा सकते हैं एयर के सामने जिससे पेशेंट कूल हो. नेक्स्ट, टेक ए कूल शावर और बाथ. तो एक टेक ए कूल शावर ले सकते हैं, बाथ ले सकते हैं इफ यू आर just wait. Next, take a cool shower and bath if you are outdoors and not near to the shelter. Soaking in the cool pond and steam can help bring your temperature down. So we can take the cool shower and bath if you are outside near the shelter and soak in the cool pond. Cool pond में जा सकते हैं, steam the help by your temperature down. Next, rehydrate the patient. We will provide the patient drink plenty of the fluid. Also, because you lose salt through the sweating, so you can replace salt and water with the some sport drinks. Some sport drinks we can replace the salt and water in the bodies. If your daughter has restricted the fluid, salt intake, so you check within him or her to see how much you should drink water and whether you should replace salt. So you can replace the salt waters in some sport drinks के द्वारा we have to rehydrate the patient and this is the plenty of fluids. Next, don't drink sugary and alcohol beverage to rehydrate. So alcohol beverage or sugary drink don't give the patient for rehydrate because these drinks may interfere with your body ability to control the your temperature. So this drinks the interfere करती है body ability को control the body temperature करने में. Also very cold drinks can cause the muscle cramps, cause the stomach cramps. If you are very cold drink you are taking, you are giving to the patient, so also cause the stomach cramps will be there. Next, nursing care for heat stroke patient. Monitor the vital signs. Next, immerse you in the cold water. A patient को cold water में immerse करना. A bath of the cold and ice water has been proved to be the most effective way of the quickly lowering the body your core body temperature. So we have to immerse the body in the water, cold water, and it is reduce the body temperature. Next, use evaporation cooling temperature technique. We have to use the evaporation cooling technique to reduce the body temperature, to reduce the room temperature also. Pack you with the ice and cooling blanket. So we have to pack the patient with ice and cooling blanket. Give you medication to stop your shivering. We have to give the medication to stop the shivering. Next, if in heat stroke, a person body temperature rise to 10 Fahrenheit, degree Fahrenheit, and 40 degrees Celsius or higher. In this condition, unlike heat cramps and heat exhaustion, however, heat stroke is a life-threatening condition. So unlikely heat cramps or heat exhaustion is there. So however, heat stroke is life-threatening condition. जो भी इसमें है लाइफ थ्रेटनिंग कंडीशन हो सकती है. तो नंबर 1 we have to do prevent the life threatening condition. Number 1, identify the triggering factors. What are the triggering factors to increase the temperature of the body? So we have to identify the triggering factors. So what is the triggering factor to increase the body temperature? That is we have to identify the room temperature, yeah, environment temperature, which are the increase in the body temperature. Next, monitor the patient's heart rate, blood pressure, and especially the tympanic or rectal temperature. Core temperature we have to manage by we have to measure by the rectal temperature. Next, determine the patient's age and weight. We have to determine the patient age and weight. Next, monitor fluid intake and urine output, IO chart, we have to maintain if the patient is unconscious, central venous pressure or pulmonary artery pressure should be measured to monitor fluid status. So we have to measure the CBP and central venous pressure and pulmonary artery pressure we have to measure to monitor the fluid status. In this condition, review serum electrolyte. We have to review the serum electrolytes, especially sodium, serum sodium. Serum sodium we have to review. So serum sodium, patient is going to hyponatremia, is not going to hyponatremia. So we have to measure the serum sodium, especially heat stroke patient. What are the nursing care? Fan air over the patient while waiting their skin and with water from a sponge and garden hose. तो fan air over the patient ऊपर fan air over चलाना है when the waiting area में their skin with the water from a sponge and garden hose. Next, apply ice pack to the patient armpit में ice apply करना है and groin area and neck and back because these areas are the rich with blood supply, blood vessels close to the skin. So that's why we are apply the ice pack to the these areas. Cooling them may reduce the body temperature. That after that we are cooling them may reduce the body temperature. Body temperature reduce हो सकता है. Next, immerse the patient in a shower and tub of cool water. Patient को immerse करना है shower में हो cool water tub में. Next, if the person is young and healthy and suffered heat stroke while the exercising vigorously, so what known as additional heat stroke. So you can use the ice bath and help cool the bodies. So if person is young or healthy है सपोर्ट कर रहा है heat stroke से exercising vigorously कर रहा है तो what's known the adjustment heat stroke, so we can use the ice bath to help the cool the bodies. Next, raise the side rail at the all time raise करना है side rail को. Start intravenous normal saline solution at order as indicated. We have to start the NS solution or at indicated. Provide high calorie diet or as indicated by the physician. Physician को द्वारा जो indicated है provide the high calorie diet. Next, educate patient and family members about the sign and symptoms of the hyperthermia. So we have to educate the family members patient what are the sign and symptom of the hypothermia and help in identifying factors related to occurs the fevers or what are the factors of the occurs of the fevers and discuss importance of the increased fluid intake to avoid dehydration. We have to discuss with the family members what are the importance of the increased fluid intake of the avoid the dehydration. And nursing diagnosis, Nandan nursing diagnosis. American Nursing Diagnostic Association, hyperthermia will be there, fluid, electrolyte, fluid, volume deficit, nausea, anxiety, knowledge deficit, and confusion. Prevention of the heat stroke. How to prevent the heat stroke? When the heat index is higher, so best don't stay in the air conditioned environment. If you must go outdoors, you can prevent the heat stroke by the taking these steps: wearing the lightweight, light colored, loose fitting clothing, and a brimmed hat, wide brimmed hat pehniye. Use sunscreen with a sun protection factor SPF of the 30 or more. Next, drink extra fluid to prevent dehydration. It is generally recommended to drink at least 8 glasses of water, fruit juice and vegetable juice per day because heat-related illness also can result from the salt depletion. It may be attributable to the substitute and electrolyte-rich sports drink for water drinking water during the period of the extreme and heat humidity. So we have to carry the drink extra fluids with us. We have to take the 8 glass of the water per day, fruits and juice to prevent the heat stroke. To take additional precaution when the exercising and working outdoor, if you are doing the servicing, field work, exercising of the outdoor work. So the general recommendation 24 ounce of the fruit, 2 hours before exercise. So generally during the 24 ounce of the fluid before 2 hours before exercise and consider the adding another ounce, 8 ounce the water sport drink right before exercise. During the exercise should consume the 8 ounce of the water every 20 minutes. Even if you don't feel thirsty. Next, reschedule or cancel outdoor activities. Reschedule कर सकते हैं and cancel outdoor activity कर सकते हैं. If environment temperature is higher, if possible, shift your time outdoor to the coolest time of the day, either early morning or after sunset. So after sunset, early morning, you can go the outside of the door. Heat stroke, where the light loose clothing assimilate to the hot condition slowly. जो hot condition है उसको धीरे धीरे assimilate करना है assimilate करना है. Next, avoid exercise during the hottest part of the day. Next, stay well hydrated और stay well hydrated. Next, what are the complication of the heat stroke? So heat stroke can the resume numbers of the complication depending on the how long the body temperature is higher, severe complication. Vital organ will be damaged without a quick response of the lower body temperature. Heat stroke can cause your brain and other vital organ swell and possibly resulting in the permanent damage. Permanent damage भी हो सकता है if you are not taking the treatment of the heat stroke, you are not lowering the body temperature, so your vital organ will be damaged. That will be there without prompt and adequate treatment of the heat stroke can be fatal. So heat stroke जो है वो fatal हो सकता है और death हो सकती है. Thank you for listening me. Now other condition we will discuss. Now other condition we will discuss the hanging. What is the hanging? What is the management of the hanging? Or what is the hanging? Hanging क्या होता है? What is the hanging and what is the management of the hanging? We will discuss in the emergency management. Introduction: about 3,500 people die each year in the United States from the form of the suicidal hanging and strangulation. It's the third common form of the suicide. It is a third common form of suicide. Hanging is the most common choice for people who suicide successfully in recent. तो रिसेंटली जो है ये जो चॉइस है पीपल की, ये थर्ड मोस्ट कॉमन चॉइस है हैंगिंग की. जो हैंगिंग जो है सोसाइटी की मोस्ट कॉमन चॉइस हैंगिंग है जो सक्सेसफुली रिसेंटली हो पाए गए हैं. What is the definition of the hanging? Hanging is the suspension of a person by the ligature and or noise around the neck. The hanger is the suspension of a person by the ligature or noise around the neck by the Oxford English Dictionary. This is a definition of the handle. Classification of the handle. Classification of the handle में these are the non-judicial and judicial handling. Next, complete and incomplete handling. What are the clinical features of the handling? Hamlet with a neck, brownish grove in the neck, hoarseness and stridor will be there. Next, pain on swelling. Next, subconjunctival hemorrhage will be there and tedious spots will be there. These are the tedious spots will be there. Bluish blood vessels will be there. Next, blurring of the visions. Blurring of the visions. Next, construction of the visual field. Construction of the visual field. Next, loss of conscious 6 to 6.5 seconds. Next, hypoxic conversion will be there. Next, EKG minimal changes will be there. ECG minimal changes will be there. Next, conversion will be there. Next, cyanosis will be there. Next, involuntary urination will be there. Involuntary defecation will be there. Next, bradycardia and dilatation of the pupil occurs. These are the signs symptoms of the handling. Now, pathophysiology of the handling, neck pressure. Next, venous neck pressure leads to venous obstruction, status, hypoxia, common carotid artery obstruction. It leads to loss of consciousness. It leads to decreased neck muscle tone. It leads to vertebral and common carotid artery obstruction. It leads to death. These are the pathophysiology of the handling. Next, complication of the handling, fracture of the larynx, fracture of the larynx. Next, soft tissue edema. Next, hoarseness of the voice. Next, dysphagia will be there. Next, bronchopneumonia will be occurs. Next, lung edema will be occurs. Next, patient will occur the ARDS, acute respiratory distress syndrome will be there in the complication of the handling, and progressive dementia will be there. Korsakoff syndrome will be there. Amnesia will be there, and accessory nerve injury will be there, and thrombosis of the cervical artery will be there. What are the management of the handling? Number one, ABC. So we have to maintain the ABC. ABC, airway, breathing circulation, we have to maintain. Next, aggressive airway management is essential. Aggressive airway management is essential. Most delay, mortality result from the pulmonary complication. In most delay, the mortality result from the pulmonary complication will be there. Use of the fluid for hypertension. If patient is going to the hypertension, we have to start the fluid. Next, cardiac arrhythmia, we identify and treat it. Cardiac arrhythmia will be there and identify, and it should be treated and treat the ICCP, intracranial pressure. Next, other investigation, X-ray of the neck, observe in the hospital at least 24 hours. Potential useful of drug, phenotine, reduce the chance of the seizures with them the phenotine. Phenotine दे सकते हैं, has been shown the helpful the arresting the development of the centroneurologic ARDS. Naloxone reverse the sign of the cerebral vascular ischemia. तो naloxone दे सकते हैं, we reverse the sign of the cerebral vascular ischemia. Calcium channel blockers we can give, barbiturate and steroid we can give the handling cases. Thank you for listening me. Now we will discuss the Other last condition, we will discuss the last condition of emergency management of drowning. What is the drowning? Drowning means what is the डूबना, देखो ना? What is the drowning? So what are the drowning? What are the management of the drowning? So we'll discuss now. Now introduction. Drowning is the condition when the victim inhales and ingests water through his and her respective teeth or alimentary teeth. So this is the drowning when the victim inhale the water by the ingest or inhale in the respective alimentary teeth. It's called the drowning. Death occurs within 24 hours 24 hours due to suffocation. So it will, in this condition, patient will be dead in 24 hours due to suffocation. Next, near drowning means patient nearly die from the drowning. In this condition, patient will die under the waters, that is called the near the drowning. What is the cause of the drowning? Suicidal attempt. If patient wants to do and attempt the suicide, that is drowning. Next, seizures and unconscious near the water. Near the water, patient will be unconscious and seizure will occur near the water, so it can be drowning. Next, drowning in the swimming pool. If anybody is swimming pool, maybe they are taking the bath, so in this condition, drowning in the swimming pool will occur. Next, small children have drowning in the tub bath. Small children where small children small children have the drowning in the bathtub, so we have to careful for the small children if they are taking the bath in the tub, so fall during the boating. If person they are doing the boating in the rivers, so they can get the fall and drowning will be there. Sign and symptom of the drowning: body is wet, cold hands and legs, bluish discoloration of the body, especially lips, shivering, restlessness, unconsciousness, confusion, fatigue, discharge from mouth, vomiting, and increased and decreased rate of the breathing, absent breathing, and gasping. These are the signs symptoms of the drowning. Abnormal sound, gargling sound will come from the mouth, and decreased heart rate will be there in the drowning. Alleged foreign material attached in the body, no breathing and no pulse, so cardiac arrest will be there. Types of the drowning: wet drowning, water is inhaled inside the lungs, so that is the wet drowning. Lungs cannot exchange gas properly. Breathing and circulation is stopped, that is a type of the wet drowning. And dry drowning, water does not enter the lungs. Water does not enter the lungs due to immediate spasm of the upper airway. So no and air entry from the upper airway, the patient will go to the dry drowning. First aid management of the drowning. During the drowning, yourself, your safety first. Don't just jump in the water. Throw the light object like jacket, life jacket, wooden pieces, and rope, rope for the patient to catch. Rescue the patient from underwater. Lie the patient on the flat surface. Remove the whole weight of the cloth and make the patient warm. Assist the patient. Look, alertness, ABPU, alert, voice and pain and unresponsive still, we will check. Chest movement, we have to check. Listen, heart sound, we have to check. And feel air passage through the nostril by the nose, by the fingers. We have to check the patient is feeling air, not air. No pulse, no respiration. Immediately, you have to start the CPR. If patient is no pulse, no respiration, so you have to immediately start the CPR. Patient breathing but has difficulty. Any patient breathing but has difficulty to maintain ABC, so you have to maintain the airway, breathing, circulation. If patient is breathing in difficulty, manage the if injury is there. So injury is there, so you have to manage if injury is there. Next, Maintain airway patency. Left lateral position we have to provide to clear the circulation, foreign bodies from the mouth. Don't insert the anything of the mouth like a spoon. Head tilt, chin left, and jaw thrust to prevent the tongue fall. So prevent the tongue fall, we have to with the head tilt, chin left, or jaw thrust. Lotion type clothing अराउंड द नेक, नेक के अराउंड टाइट लूज करना है और क्लॉथ रिमूव करना है, लूज करना है. रिमूव आर्टिफिशियल डेंचर if possible. If patient is having artificial denture, so we have to remove to prevent the tongue fall. Next, remove excessive water from the lung and abdomen by the turning upside डाउन. पेशेंट को उल्टा लगा के टर्न उल्टा टर्न करके अपसाइड डाउन करके और प्रेसिंग ओवर द एब्डोमेन और reassure the patient. Immediately transfer the patient. Immediately transfer to the hospital or reassure the patient. We have to reassure the patient or immediately transfer the patient to hospital. Complication. What are the complications of the drowning? Cardiac arrest will be there. Pulmonary edema will be there. Pneumonia will occur. Stroke should be there, will be occurs. Cerebral edema हो सकता है. Renal failure, patient may be go to the renal failure. Metabolic changes होते हैं. Next, infection will be there. Next, prevention of the drowning, brainstorming. So we have to brainstorming to the patient to prevent the drowning. Thank you. So now we finished the discussion of the emergency management of these conditions. Thank you very much for listening me. I hope that you are understood emergency management of these conditions as like poisoning, snake bite, drowning, hanging, and a heat stroke. So these conditions will cover the emergency management of this topic. So thank you for listening me. If any doubt, if do you have any doubt, you can ask freely.
Thank you so much, Deepak sir, for presenting such a valuable topics regarding the emergency management. I'm very sorry I was not available at the starting due to some previous commitment. But I'm sure that I just connected at 3 o'clock, and from that I started with hanging topics, and up to the time it was very much presentable, and each things was very much clear in your all the slides, such as what is the topic, what are the symptoms, what are the risk factors, how you can manage, what are the nursing care associated with the topics. So each thing was very much and very well explained by you. Thank you so much for accepting our invitation and giving your precious time to explain our students and the participant regarding the emergency management. Emergency can happen anytime, and all these things, these things are the regular things. They are coming in the fractions of all the candidates who are joining, who are already joined, and the participants. So I wish, and I'm very much sure that they are now confirmed with the management what can be the first step being a nurse towards the emergency. Thank you, Deepak sir, on behalf of
Welcome, ma'am. Welcome, ma'am.
all my participants and Samarpan group, and we are very thankful to you, and we wish that in the future programs also, future series also, we will love to have you, and definitely will be there. As I'm not able to see your picture, I request to my coordinators to take some pictures, because today I was not in my office. I am on the way somewhere.
Yes, ma'am.
So thank you, Deepak sir. Thank you so
Okay,
much.
ma'am.
And
Welcome,
please be
ma'am.
connected. And now the people knows that yes, there is a HOD and the brilliant person in the Subhati, and they learn from you. They got a chance. So they are the lucky enough to have you as a expert today. And the topic was wonderful. So thank you each one. Take care. Stay blessed. We will meet again tomorrow. Now I'm shifting myself to my coordinators because I am on the way and maybe you are getting some noise from my backside. Thank you so much. Take care,
Welcome,
everyone.
madam. Most welcome, ma'am.
Thank you, sir.